Welcome to Straight Outta Health IT. Getting into health tech is rough, but here's an unfiltered dialogue of healthcare leaders and influencers covering a wide variety of issues affecting healthcare and the health tech industry. And now your host, Christopher Cunny.
Hello, everyone, and welcome back to another episode of Straight Outta Health IT. This is your host, Christopher Cunny, and I'm so happy to have you back joining us for this week's episode. This week, we're going to be talking about the power of patient advocacy, why everyone should be their own patient advocate, and some tips and suggestions on how to best navigate our very convoluted healthcare system. So let's get started. Navigating the healthcare system can be a very challenging and confusing experience for anyone, but especially those in particular for patients who are dealing with very serious illnesses or injuries. This is where patient advocacy absolutely needs to come into play. What is patient advocacy? Well, it is the process of promoting and protecting the rights of patients and ensuring that they receive the best care and treatment possible. By becoming their own advocates, patients can take an active role in their own health care and can ensure that their own needs and concerns are being heard and addressed, or the needs and concerns of their loved ones. On this week's episode, we really explore the power of the patient advocate and why every patient should be their own advocate. We'll discuss the benefits of advocacy and we'll provide tips on how to become a more effective patient advocate. So let's get started. To explore this topic further, I have one of the industry experts that I'm excited to have on the program. And I thank her for taking time out of her very busy schedule to join us and share her insights. Her name is Dr. Kikelomo Oshunkentan, also known as Dr. Dayo, which I'm going to start using from this point forward. So let me tell you a little bit about Dr. Dayo. She is a board-certified internal medicine physician with a master's in public health from St. George University and a master's in business administration from Wake Forest School of Business. With over 20 years of healthcare experience, Dr. Dayo has a profound knowledge in payer and providers' health systems, healthcare consulting, and provides a holistic approach to the industry with a focus on high-quality, cost-effective care delivery models. She has a deep expertise and proficiency in hospital medicine with a focus on physician alignment and accountability for delivery of quality metrics, exemplary patient outcomes, and patient satisfaction scores utilizing integrated lean management principles in healthcare. Using her keen consulting lens, she has led the development of benchmark utilization tools and analyzing spending trends to help collaborative hospitals become successful in population health. In that role, she's facilitated training, support, sales efforts, and managed client relationships as well. Dr. Dayo serves as a subject matter expert to drive holistic insights and client engagements. In her prior role as medical director of Evolance Health, formerly Anthem, Dr. Dayo garnered an in-depth aptitude for administration of medical management systems for corporate health plans and oversight of medical policies in commercial business. She developed close client relationships with independent physician practice groups to help determine solutions to improve care coordination, and she oversaw COVID program initiatives which involved leadership of multidisciplinary teams and implementation of new data analytics with reporting detailed outcomes. Now, as Chief Medical Officer of Pegasystems, Dr. Dayo serves as the voice of the patient and clinical customers inside Pega organization and the highest executive representing the Pega system to their clinical customers and external audiences. She continues to practice medicine as a hospitalist because of her passion and commitment to patients, and she remains resolute to keep her thumb on the pulse of medicine to maintain the breadth and depth of knowledge of the field of medicine as well. Dr. Dayo was appointed also by the U.S. Government Accountability Office to serve as a member of their Health Information Technology Advisory Committee, the federal group working to implement a health information IT infrastructure that advances electronic access, exchange, and use of health information in the U.S. healthcare system. Wow, what an impressive background and resume. And welcome to the program, Dr. Dayo. It's a pleasure to have you on the show.
Thank you, Christopher. It's a pleasure to be here. Thank you so much for having me.
Very welcome. Now, as I always do, and for all of my programs, is I go through the read of my guest resumes, and yours is a very impressive one. But that's your resume. That's kind of the milestones of your journey. But we want to hear your story. Why did you get into healthcare? What was your passion there? What drove you into this space? Tell us a little bit about this journey that you've taken to the point of where you are today, serving now as an advocate for patients at Pegasystems as well, too. So I'll stop there and I'll let you share with our audience your story.
Sure. It began with an innate desire to help people. I was what you would call an undercover nerd. I loved reading. I loved learning new things. And I was more of a tomboy. I used to play football with the boys, with my brothers and the boys in the neighborhood. And I would follow my parents around and just to be helpful, just to have that helpful nature.
Exactly.
So the earliest memory that I can remember is me walking my dad to the sink after he cut himself on this one occasion. And he was bleeding. And so I rinsed off his finger, put it under the sink and put some ointment on it, put a Band-Aid on it, and took a pencil off his desk and handed it to him, like in doctor's office.
Right. How about this piece of candy, huh?
It was.
Yeah, nice.
And so that was one of my fondest memories. And I just walk around, with the family and the neighborhood with a first aid kit. And when I was 16, my mom had a battle with breast cancer.
Right.
Unfortunately, it was a battle that she lost at a very, very early age.
So sorry to hear that.
Thank you. Thank you. And I didn't understand what was going on. I remember eavesdropping and hearing the doctor tell my father her prognosis, and he refused to believe it. He gave her 6 months. And I remember just trying to process it and not understanding and thinking that the doctor didn't know what he was talking about.
Right.
Long and short of it all, what he said came to pass. And because she was late stage, and he asked my dad to tell us, and he said, no, in our culture, we don't tell the kids, we shelter them.
Exactly.
And so it wasn't until later that I learned what this oath was that he was referring to, the Hippocratic Oath. But that's a little bit of how I came into medicine and my desire and continued pursuit of medicine in terms of helping others and understanding what happens to the human body.
Absolutely. And I think I would imagine also your first exposure to seeing your father advocate to a certain degree for your mom as well. Yes. And either the challenges that existed at that time or even his denial to some degree of her prognosis as well. And what alternatives might have been available to them at that time to maybe get a second diagnosis or a different treatment plan. So, well, we want to thank you for choosing this path. And it's amazing how our life experiences shape who we are as human beings. So fast forward, you've gone through medical school, you're practicing medicine, and you've now started to move into the corporate space. What shifted you from the day-to-day practicing of medicine as a hospitalist to now wanting to step on the dark side and work on in the corporate environment?
Are you going to go straight for it?
I'm going to go straight for it. Yeah.
I'm here for it. So it's so funny. It's a great question, Christopher, because I've been asked that. And what happened was I was practicing medicine, but it was the politics that drove me out.
Right.
It seemed that medicine was becoming more and more of a business and less focused on the patient.
Sure.
And that was problematic for me. And so I started just trying to identify other areas in which I may be able to impact patients in a positive way. And so I decided to then pivot to the payer space, where I had the opportunity to work as a medical director at Elevance Health. And shortly thereafter, maybe about 2-3 years into that role, I started feeling a restlessness in my spirit, like I'm being called to do more.
Sure.
And so it was at that time that I started pursuing my MBA, and my dad started to get sick at the same time.
Oh.
Yeah. And so I felt in my spirit it was time to move to another job. So I applied to a myriad of jobs, and I got a lot of interviews, and Pega was one of those.
Right.
And when I interviewed, it was funny. They were very passionate about patient outcomes. And I'm like, surely this can't be.
Right. Who's this company in?
Right? How can they be equally or more passionate than in healthcare?
Exactly. Than the provider themselves, right?
I know. So I said, certainly they can't keep this facade up.
Sure.
And so the second interview, they brought the same energy. The third interview, and so forth. And so here I am, because I feel that we are aligned in our values.
Mm-hmm.
We are aligned in what is necessary to move the needle in healthcare and to help our clients achieve those goals, and ultimately to help the patients optimize their health and become empowered.
Absolutely.
So that's why I'm here.
Sounds great. Well, I applaud Pegasystems for making a very smart choice and bringing you on board and helping to lead that effort and bringing that clinician perspective to the table as well, too. And my condolences on, the journey that you've taken with your parents. I've had a similar journey with both my parents, who are also deceased, and had to navigate the healthcare system with them. And even with my own experience, having been diagnosed with a brain tumor, actually 2 brain tumors in 2016, and going through a myriad of tests and healthcare providers and healthcare systems to really try to, one, diagnose the issues that I was dealing with prior to the diagnosis of the tumor, but also just the frustration of collaboration between, or lack thereof sometimes, with clinicians and providers, the insurance, navigating the insurance process, and just trying to be educated and aware so I can make the right and smart decisions about my own personal health, and also the health of my loved ones, my parents, who, again, both ultimately passed from their illnesses as well. So let's explore that whole concept a little bit further about exactly what does it mean to be a patient advocate, and how can they support the patient through that journey. Give us your perspective on it, your definition of what that is, and how you personally have even had to advocate for your loved ones.
Yes. Well, to me, a patient advocate is someone who has enough medical knowledge about the healthcare system in terms of how to navigate it, as well as an understanding of the language, the healthcare providers, to be able to at least effectively communicate their concerns and well wishes, someone who can convey in a manner in which they're heard. I think that being an advocate allows you to speak on your own medical conditions, on your own medical illness in a way that is thought-provoking in terms of really engaging the provider.
Exactly.
And 2, getting your questions answered. And then 3, knowing how to navigate between the payer and the provider in a way that you don't have any gaps in your care. And that's a really big shoe to fill.
Yes, it is. I mean, even for those of us who are in the healthcare ecosystem and understand kind of the back door to navigate things, and even relationships that we may have with individuals within the health system that can help us, it still can be a very daunting task. And especially for those who are not a part of the system as a whole. When we were preparing for this interview, you had shared a story about a relative who was taken to the ED.
Yeah.
And I won't steal your thunder on this, so I'll let you tell the story and how you had to step in and advocate. Would you share that?
Absolutely. It was a number of years back. I was studying for the boards, and I got a call from my sister telling me that our loved one was in the hospital, and she had signs that were very concerning. And she told me, I said, well, what signs? And she said she gave me her symptoms. And I'm like, she sounds like she's had a stroke. Albeit she was only 25. And so the doctors were like, oh, she couldn't have had a stroke. She doesn't have any significant risk factors like hypertension, diabetes, nothing like that, right?
Sure.
Or dyslipidemia. And so I asked her to put her on the phone. And as soon as she came on the phone, Christopher, I kid you not, she sounded like she drank a case of beer.
Right.
Because her speech was slurred and she was just not as coherent. She was not near her baseline at all.
Exactly.
And so I immediately cut the conversation short and asked to speak to the doctor. The doctor came on the phone and I said, out of professional courtesy, do you mind getting an MRI? I know the non-contrast CT of the head was negative. I said, but please get an MRI for me because she's got a risk factor. She's got underlying lupus, which in itself is a risk factor for stroke.
Sure.
He obtained that MRI and it was positive.
Right.
So it changed the trajectory of him discharging her home to a 5-day stay in the hospital.
Wow. Well, again, thank goodness your loved one had someone who had a clinical background, not only just a clinical background, but you were a physician and could, intercede and garner the respect actually of the other clinician on the other line. I could imagine if it was just a parent saying, can you get an MRI and had no clinical background.
Exactly.
What would that clinician had said to them? Go pound salt?
Great point.
Right. And so, and you'd mentioned earlier that an advocate has to have a good understanding of the system and how to navigate it. And the reality of it is that most Americans, I'll use Americans and probably most people across a broader spectrum than that, don't have people like yourself in their lives, right? They don't have a clinician who can get on the phone and help to navigate that or even provide kind of a second opinion on your health,
right,
as quickly as you did. But so for those who aren't fortunate enough to have someone like you in their life, are there some basic things they should know? For example, talking to the charge nurse, or how do I escalate an issue if I'm not happy? Yeah. Just some of your kind of down and dirty practical advice for the novice person navigating our healthcare ecosystem.
Well, I think first what I want to convey is that patients should know that they have rights.
Right.
First and foremost, I want them to know that we have jobs because of them. So it's crucial for them to understand their gravitas, like their amount of worth to the healthcare ecosystem, because they are the core of what we do.
Right.
So if they're aware and empowered by knowing that they have rights as patients to receive quality care, and at least it doesn't mean we're going to always do exactly what patients want us to do, because they didn't go through the years of training and education.
Exactly.
They have a right to be heard. And if they feel that they're not heard, then it's incumbent upon them to seek out the charge nurse, because part of her role is to serve as that advocate for the patient and speak to the doctor and make sure that their wishes are known and why. The reason that's important to the healthcare system is because of reimbursements, right? So if we have financial incentives tied to patient satisfaction scores. Guess what we're going to try to do? Bolster up the scores. But as I said before, in a manner that is beneficial to the patient. We're not going to do anything that's harmful just to increase the scores. So reaching out to the patient, to the charge nurse, or asking the physician to reconsider and giving them an explanation in terms of why. Sharing their family history. You've got to know your family history.
Sure.
Because they may just look at you from a textbook, and you very well might not be a textbook.
Exactly.
Kind of patient.
I think your example is even just sharing that situation that your loved one had lupus, right? Was that even discussed prior to that clinician making their decision on how they would treat the patient?
Right. And those are some starting points to use to help at least get your voice heard.
Absolutely. But what about a second opinion? I think especially with the older generation of individuals, I know in my family anyway, they tended to trust their healthcare professionals without question, like kind of the white coat syndrome, right? The doctor is the most knowledgeable, he or she's God, and I'm going to abide by whatever they say, even if it's not something I think is to my best interest. I can think about the example of my mom, who for years was going to her primary care physician and was letting him know that she was seeing blood in her urine. And unfortunately, he did not request additional tests, told her that that was kind of normal for that to happen. And ultimately, over years, it got progressively worse to the point where they had to do further testing. And it was determined that she actually had cancer of her kidneys. And unfortunately, by the time it was discovered, it had metastasized.
Yeah.
And a year and a half later, she succumbed to her battle with cancer.
I'm sorry to hear that.
And I'm not necessarily saying that the blood in the urine would have probably led to some discovery of the cancer, but I don't think that makes sense to me. I mean,
it makes absolute sense that is not normal.
Right. And I'm not a doctor, but I don't think that's normal. And I would try to explain to my mom as well, too. It's like, look, you wouldn't keep taking your car to the same mechanic with the same problem and not getting it fixed and just abiding by that. That's normal. Your car's supposed to act this way. Why do you think your body is supposed to act this way and that not be something abnormal? And so I think sometimes an advocate obviously can offer that differing opinion, right? And perspective.
Yeah.
And maybe had she had an advocate at the time, it wasn't until it was much too late that we got involved, that had she had an advocate early on, we might have either forced that doctor to do additional testing or got a second opinion for her. Who knows? We might have been able to discover something far in advance before it got much more challenging for her. I'm curious from your perspective, obviously there are good doctors and there are bad doctors, and there are doctors who do respect the patients pushing back. Is it okay for patients to push back? And what's kind of the best approach for patients? Because I don't necessarily want to immediately say, let's go get a second opinion or replace the doctor, especially if it's someone we've been dealing with for years. But also, you know your body better than anyone else, right?
Right.
And if you don't feel like you're getting the right answers or things aren't getting better, what do you suggest a patient or an advocate do to try to have this type of crucial conversation with the healthcare provider?
That's a great question, Christopher. And you hit the nail on the head, honestly, because if you have years of a relationship with a provider, right, you would expect that they would listen to you, just like in a personal relationship. You would expect that in a professional relationship, right? And so my concern about that is if he's not listening to you and he's known you and you know your body, there's a breakdown there in communication. And so I think that you are completely within your right to seek a second opinion. In fact, I encourage it. It doesn't undermine that doctor, but if he is not hearing you, then I think that that's the next step, ultimately.
Exactly. No, great suggestion. You know, there are also kind of the administrative challenges we experience as patients. Trying to get access to my patient records can be a challenge sometimes for patients. Understanding what we covered in my insurance, getting an appointment with a doctor. I just scheduled, and I know this isn't evasive, but I just scheduled a annual physical exam, and the earliest I could get one is 2 months out from my primary care physician, who I've been going to for over 20 plus years.
Yeah.
Any suggestions on how we best navigate some of those administrative challenges that exist, and or just, you know, I'll just leave it at that.
Well, what I recommend you do is schedule your appointment at the time of your last appointment. That's what I do. And out of the office, I'm like, oh, can I schedule my next annual? And I don't have to worry about it for a year because I like to do it around the same time.
Sure.
And so that's what I do. But I think that providers and payers alike are starting to notice that it's infinitely more difficult for patients to be able to schedule and navigate through this, at least the administrative portion of this healthcare ecosystem. And so they're trying to increase access to patients by patient portals and online digital services so that they can take that ownership back and schedule appointments at their own time. So I'm seeing that drive towards that. And I think that it's going to certainly continue and hopefully break some of those barriers down. In terms of understanding your insurance coverage, I'll be the first one to tell you, I don't know all the things that I'm covered for.
Right. No,
but I do know the number on the back of the card that I can call and find information. So I say all that to say that, or sometimes I even will go online to the web service and to see. So they're starting to put some of these things at the tip of our finger. So I think that hopefully this shift to try to engage patients will prompt some of us to be, I guess, more astute in how to handle these administrative challenges.
I think to your point too, I mean, there's a lot of that in many cases is a generational gap as well too. The, you know, baby boomers who weren't digital natives and now having to now leverage technology, and depending on where you are on that continuum, those who are very comfortable with it, very savvy with it, and then those who shy away from it like it's the plague, having a patient advocate who is comfortable now the technology, because to your point, you may be able to alleviate some of those frustrations that you have in the administrative side because a lot of this stuff is already online, right? Patient portal, it's on the website. There's an automated way of still navigating the healthcare system, which is probably more efficient than trying to pick up a phone and call someone, which these days and times can be less efficient. So ensuring that your advocate is also knowledgeable and comfortable with technology and can step in those areas where you may not feel as comfortable, and again, navigating some of these emerging technologies as well. I think it's definitely an important lesson to take away from this conversation. Talk to us a little bit about, again, that correspondence between the doctor and the patient.
Yeah.
Are there any tips and tricks that you think, as a doctor, as a clinician, what turns you off from a patient when you're trying to communicate with them or their advocate? And then what really gets you engaged with, okay, I'm going to sit here. I know I'm only supposed to be here 15 minutes and I got to get to my next patient, but I'm going to stay here another 5 minutes and have a more in-depth conversation with this patient because they did X.
Yeah. Well, it all depends on the nature of the interaction. Like if the patient approaches you in a manner in which they are trying to understand their health and partner with you in terms of co-managing, that always encourages and fosters more conversation. Because at the end of the day, the way I see physicians are as teachers, right? And we have to be able to convey the medical diagnosis or conditions to the patients at the level in which they understand it. And I pause to emphasize that because lower health literacy can lead to unrealistic expectations.
Exactly.
And those unrealistic expectations can then breed further mistrust of the medical community.
Right.
You know what I mean? And so health literacy for me is another social determinant. And for us to arm patients with knowledge and improve their health literacy, that in itself is a distributable asset in the fact that it's almost like that proverb, you either give someone a fish or you teach them how to fish, right?
Exactly.
So if we teach them how to fish, they can further educate their family members and it can be spread, right?
Sure.
However, a patient approaches you in a way that's combative, or I want you to prescribe this for me, or they have it in their head that they know what is best for them. And they don't leave much room for conversation. That's a bit more tricky to navigate. And you kind of want to cut that encounter shorter, in my experience. It really depends on the nature of the patient and really what they're there for, whether they want you to prescribe a drug or whether they want to learn more about their medications, want to learn more about health and how to partner.
Absolutely. Or that patient that is very knowledgeable and has gone out and done their own research and have read the periodicals and medical journals and, look, I've researched this illness or issue or what I think I have, and I think I've got X, Y, or Z, and here's my body of evidence I'm bringing with me.
You know what? I hope you're going to let me interrupt because I want to challenge you there.
Yeah.
Christopher, you know your background.
Right.
You are a very wise man, a very educated man, and I know that you can read medical journals.
Right.
Those are the type of patients that we're not as, concerned about because you can engage and have that conversation.
Right.
That's why I tie it back to my concern earlier about health literacy. Because those patients who cannot engage in those, we're further widening that gap.
Sure.
So having access to medical journals, they can't consume that information. They can't understand that information. In fact, just last night, I was out in the yard finishing some yard work, right? And a neighbor passed by and I heard him talking with his wife. Yeah, I went to the doctor. I didn't understand anything that he was saying. He used some words. Yeah, and I live in a nice neighborhood. Right. And so inside I was stirring and I was like, should I say something or should I not? And so I decided to. I said, well, what did the doctor say that you have? They looked up at me and I said, I'm a doctor, so I just want to see if I can help you understand. He was like, he used words that I don't even remember.
Right.
And I looked at him and I looked at his wife. I said, we've got to do better. And she was like, yeah.
Yeah. And it's also interesting that the patient didn't come back and say, I don't understand what you're talking about.
True.
I don't understand what that word means. Please demystify that for me.
And that's part of that.
Using all this Latin and all this medical terminology that I have no clue about. And I'm going to shake my head and act like I'm smart and knowledgeable just because I don't want you to think I'm an idiot or something. When in fact, I'm walking out of there. You're probably even more fearful because you use some scary words that I don't know what they are. And now I'm sitting here shaking my head and saying, what do I do? And so I think as advocates, we also have to be prepared for ourselves and then for our loved ones to say, look, okay, what does that mean? Break that down.
Exactly. Break it down for me.
Yeah, break it down for me. I mean, that's great that you know that term, but I don't know what the hell that means.
Yes.
So help
it's
me
so
out.
funny because when I was a resident, I was interviewing patients because I was doing the H&P, and I got frustrated, Christopher, patient after patient, when I asked them what they were diagnosed with, what their past medical histories were, they couldn't answer. And the last patient had it, I guess, because I was like, why don't you care? And she looked at me and she was like, doctor, it's not that I don't care. It's that my doctor didn't tell me. Because they have diagnosis listed in their charts, but they don't even know that they were given.
Exactly.
And so I made a conscious
And I'd be charged for, by the way.
Right? That's so true.
Right.
And so I made a conscious effort at that time. It struck me to my core that we are not communicating with them in a way in which they understand. We're not telling them their diagnosis, and it has nothing to do with them caring or not caring. We got to do better.
Yeah, on both ends, for sure. The doctor needs to, or clinician needs to ask the patient, do you understand what I just shared? And the patient's got to be comfortable and open enough to say, no, I don't. Can you clarify that for me?
And, I don't want to be just on one side of the fence because at the same time, healthcare has changed tremendously. Physicians now don't have the capacity or time to be able to have those conversations in a depth that is going to be meaningful to the patients. Honestly, it's just not fair, but it is unfortunately something that we are going to have to find a way to navigate around in this profession that we've pledged to do.
Absolutely. So I'll give one other example. What about the patient that wants to bring in, okay, they've got the Fitbit and the technologies and all this data. Hey, here's my sleep cycle doctor. Here's my Fitbit. Here's the number of steps I've been taking for the past month. All this data that's now on my Apple Watch or Google Watch or whatever you name the watch of the day. And I'm bringing this to you because, hey, I think this is wrong about what's going on with me. How do you as a doctor feel about that?
Gulp. That's a lot of stuff to try to get through in the time allotted.
Right.
It'd be great if they can fax that prior to their visit so you'll have time to consume it and be able to talk intelligibly about what it needs.
Sure.
So, yes, we want patients to own their health. Yes, we want them to be partners. Yes, it does take a lot of time. And so I think that for it to be impactful for them as well, deliver that before your appointment so we can interpret it. Yeah,
absolutely. Absolutely. Good. And I think, again, that's where these technologies like the patient portal come into play, where you can upload that information or document that information in the patient portal, and the clinician could have access to that on
That's it.
As well.
Not only that, right? But with the advent of AI, we've had AI for a while, but it's getting smarter and smarter. And so it'll be able to pull the insights from all those disparate sources that the patients are feeding us and pull out the most important thing and summarize it for us, right?
Absolutely.
So
exactly. So I'm going to ask another tough question. What if you're a patient that feels like the doctor is not providing the best care possible because there's some inherent bias there? Because you're
a great question.
Male and female, maybe it's gender related, maybe it's race related.
Or even education related.
Yeah. The doctor's being very condescending because you're not, a doctor and you're not maybe even a high school graduate,
Yeah.
What should the patient do?
Fantastic question. It's so funny. I still keep in touch with some of my patients. In fact, I spoke to one like 2 days ago. I'd given them my personal cell number. And she had shared with me that she had a thymoma, which is a mass in the thyroid, right? Anyway, they found it.
Explaining that because I was going to ask you, what the heck is that?
I know. See, I've gotten good. I've gotten better.
Very good.
So they found on her surveillance scan, they found an incidentaloma. That is an incidental finding, meaning by accident. And they found this aneurysm on her splenic artery. And the doctor was like, it's gotten bigger than last time. We've got to resect the spleen. We've got to cut out the spleen, that portion where this artery is running. And he was like, don't worry about it. You don't really need it, part of your spleen anyway. And she was like, what? I don't need part of my spleen.
Right. It's there for a reason.
Exactly.
Right.
And so he didn't really talk. Well, allegedly, I got to do that. Allegedly, he didn't talk about the benefits, the risk, or the alternatives in terms of what that means to her about taking a part of her spleen away.
Right.
And she went home and did the research. And she was like, yes, I do very well need my spleen.
Exactly. Right.
I'm like, yeah.
It's no reason.
Right. It filters.
Right.
With technology, they're going to research that stuff. So she was very displeased. She felt like he brushed her off, like minimized the surgery and so forth. And now she asked for another opinion.
Mm-hmm.
And they told her that you can't ask for another doctor within the same group. So she even tried to advocate. Yeah.
Sure.
Yeah. And some practices are like that because they don't want patients to be doctor seeking. I get it.
That's kind of an oxymoron, though. If I'm not happy with my care, why can't I go talk to another doctor?
I know.
Why can't I talk to another doctor in that practice versus having to go outside of that practice and now navigate, again, the complicated healthcare system? That seems to be strange.
But I guess to his point, give that doctor a chance to rectify the situation.
Okay.
You know, give him a chance. And so I think what they're going to do is what I suggested that she does is share your concerns. Just don't say, I want another doctor. Share why. And let him then be accountable for that. And
or her.
Or her. I'm sorry. Or her.
Right.
Well, the reason I said her, because, we wouldn't do that. No, it's not her.
Absolutely.
Yeah, patients love female doctors.
Yes.
But anyway, so putting all that just aside, I think that really is what the point is give him another chance to try to rectify the situation. If he still doesn't meet your needs and if you still don't feel heard, then every right, she should go out into practice and find somebody else.
Absolutely. Well, great. Thanks. They're great advice. Well, as I suspected, we're coming to the end of our time. Probably had another 10 questions I wanted to ask. You definitely have to come back and we'll do part 2 of this conversation around patient advocacy. But as we wrap up this segment of Straight Outta Health IT, are there some kind of 3 or 4 or 5, whatever, bullet points or ideas that you would want to offer to our listeners in terms of here are the things you need to think about as an advocate, whether it's for yourself or for your loved one, that you would recommend they follow?
There are. I would recommend that continue to advocate for yourself because patients know their body and only you can provide that comprehensive view of your symptoms,
right?
What your needs are, what barriers to your care exist. You can clear up any misunderstandings between the provider and yourself. And it also gives you an opportunity to learn and also educate yourself, resulting in self-empowerment. And with that self-empowerment, then you can actively participate in your care and in shared decision-making with your provider. And piggybacking off that story I just told, that patient of mine was able to catch medication errors that the doctor was going to prescribe.
Right.
So advocating for yourself and learning about what your health conditions are and what treatments you're getting, what treatments exist, is only going to bolster up your health overall. I do advocate for patients to, sometimes when they see doctors come into the room, we have this gift of making their questions vanish in thin air. So I would recommend that they write their questions down, be honest and specific. Some patients want to kind of hide or minimize their symptoms, but share it. And also be an active listener. And also, I think one of the last things I would recommend, take notes and or bring a friend who can listen. Because sometimes when we land a significant diagnosis, it's like the words that the doctors are saying, it may immediately evaporates through your ear.
Yeah. Absolutely. I know I had that personal experience when I was told I had a brain tumor. I can remember when the doctor said brain tumor. After that, it sounded like Charlie Brown's teacher. Walk, 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 walk. After that, I was like, I didn't hear the next 5 minutes of what you said. And I'm processing those words, brain tumor. So to your point, bringing a loved one or a friend, someone there who has a second set of ears and eyes, I think it's a great recommendation. Any other thoughts? Because I want to summarize exactly what you just said.
Well, the reason I also like patients to bring their loved ones is their loved ones are my second set of eyes. And they even identify things that the patients don't.
Right.
Or You know what I mean? And so I think it's
Sometimes we'll be more honest with the doctor than the patient will. It's like, look,
yes.
no, mom, no, you really have been going to the bathroom 10 times a day, not 2. Okay.
Yes.
I know, I'm watching you. Right? So, exactly. They can keep us honest as patients as well.
Yeah.
That's great. Well, what I heard there was a couple things in summary. Educate yourself. Try to be as knowledgeable as you can about your disease and your condition and the options you have available. Ask questions, preferably have them written down so you don't forget them, because once you get into that environment, things can go wacky sometimes. So it's nice to have them written and available so that you can now make sure you get your questions and concerns addressed. Get a second opinion if needed, if you're not comfortable with the answers you're getting.
I also like them to keep logs of what's going on.
Keep records, exactly. Keep records and logs of your medical history, the conversations you're having, those things, so that, again, track your condition more accurately and completely, or someone can advocate for you. And finally, to your point, last point, the most important point, you have to advocate. You have to speak up for yourself. If something's not right and you're not getting the care you need, don't be afraid to voice your concerns. Don't be afraid to escalate those concerns. You only have one life.
That's it.
And you want to get the best care possible. You make the assumption that people are trying to do the right thing, but there was an old saying, trust but verify, right? Make the assumption they're trying to do the right thing, but if it doesn't sound right or feel right, you have an option to get it verified, whether that's through a second opinion or to other methods as well. So I think all great suggestions. Thank you so much, Dr. Dayo. It's a pleasure to have you on the show. I'm going to have you back. We got a lot more topics to talk about. Advocacy, and I've already started having conversations behind the scenes on those. So rest assured, my listeners, she will be back on, and we'll throw some other interesting conversations for you to listen to from this amazing clinician. Any final words before we wrap up this show?
Yes, thank you. First of all, I want to thank you, Christopher, for having me on your show, Straight Out of Health IT. I've really enjoyed talking with you and getting to know you. I do want to really shine a light on patient advocates that are doing the hard work behind the scenes that aren't always noticed. And I think that I would be remiss to not thank Dr. Grace Cordovano for her partnership. Because what I love about her is, although she's a staunch patient advocate, she is not looking to replace the doctor. She's not looking to undermine the provider. What she's seeking is to increase access for the patient. She is seeking to make their voices heard. And she is also seeking to partnership with the healthcare community, the provider, the doctors, the nurse practitioners, PAs, nurses. And so I just have to advocate, and the payers, I just have to really give her a shout out, because she is one of those unsung heroes.
Absolutely. Well, definitely a shout out to her. She's one of my favorite sheroes as well, too. She had her on this program as well, too. So for those of you who haven't heard that episode, go check it out. She's an amazing individual.
Definitely.
Yeah. Well, thank you so much, Dr. Kikelomo Oshunkentan.
Oh, look at you. You're showing off now.
Thank you. I worked hard at that. It's a pleasure to have you as a guest. I look forward to having you back on the program. And thank you, everyone who took time out of their very busy schedules to listen in and hear this episode. Hopefully you found this information that we're sharing enlightening. Please share it with others. And I, first of all, want to thank all healthcare professionals who are out there every day on the front lines, providing the best care they can. You have, just an amazing challenge and task that you try to fulfill each and every day. And I do make the assumption that the majority of people out there want to do the right things, but sometimes the system makes it a challenge. And so when that happens, it is our job as for our loved ones to be their advocates, and for ourselves as well, too. So don't be afraid to do that. This episode has come to an end. Thank you again for taking time out your schedule to listen in. Please share it with others. And like I say, many of these programs, especially this one, let's make this one go viral, because it's an important topic to share with others. Take care, everyone. See you on the next episode, and God bless.
Thank you so much for listening to Straight Outta Health IT. We hope you enjoyed today's guest. For more unfiltered dialogue of healthcare leaders and influencers, be sure to tune in next week. For the show notes, transcripts, and resources, please visit Apple Podcasts, Spotify, or your favorite streaming platform. We invite you to give us feedback by reaching out to Christopher Kani on LinkedIn, just searching for Straight Outta Health IT, and you'll find us. We are constantly having live discussions about diverse topics in the industry.